Hello, ladies. Here we are today to talk about what healthy living means. We know we try to live a healthy lifestyle by doing good things like eating right, like taking supplements and exercising. But actually being healthy means so much more than that. So more specifically today, I'm going to talk to you about healthy habits and screenings that can literally be life-saving. So my name is Dr. Olivia Joseph, and women's health is one of my passions. I've been in clinical practice for over 15 years in the field of natural health care. I have a bachelor's degree in biology, a doctorate in chiropractic. I hold a diplomate in clinical nutrition, and I'm also board certified in acupuncture and Chinese medicine. So now that we've gotten through my credentials, let me share with you some very important life-saving tips and life-saving screenings that are so important for us to do as women. So let's get right into it. First and foremost is one that a lot of women avoid doing and they think may be painful, and that's a mammogram. So a mammogram is a very low radiation x-ray to look at breast tissue. Now, why a mammogram? Because you want to originally get a baseline when your breast tissue is healthy. So that's one of the reasons I recommend doing this. So some young women choose not to get mammograms because they're not as accurate in younger women or women less than 50. Age 40 to 50 is a great age range to start this, but it's definitely recommended from about age 50 to age 74 every 2 years. What I recommend is that you get a baseline when you're healthy, when you don't have symptoms, especially if you have a family history of it. I'll be honest with you, I had my first mammogram done when I was probably 33 years old. It's not painful, it's not a big deal. And the reason I did it was because I do have a family history of breast cancer, but not only that, you want to get baseline testing when everything is good. So if something shows up, you have a healthy test to compare it to. This is really important when it comes to things like x-rays, which is really what a mammogram is. So we know that breast cancer is a lot of newly diagnosed cancer in women. So we have to have some screening tools in place. And the earlier you start, the better. The other thing I am a huge fan of is thermography, breast thermography, where you can actually use a scan to see if there are any changes in the breast tissue, such as inflammation. And that may be able to detect abnormal activity in a younger, thinner, healthier demographic than a mammogram. That doesn't mean don't get a mammogram. Again, I like to have that as a baseline, so when you do have repeat ones done in the future, you have something to compare it to. So you want to do it when you have healthy breast tissue so that you can get your baseline established. So I do recommend a mammogram, and I have had one myself. Second thing, a lot of women don't like to do their well women exams, but it's such a great screening tool because when you do see your primary care or OB-GYN for a well woman exam, that screening is looking for a lot of things. It's also looking for inflammation and abnormal cells. And it's a great way to catch things early. Yes, if you have a family history, but a lot of women avoid doing this because they think it's painful or uncomfortable. It's very, very fast. It needs to be done only every couple or every few years. And again, you want to get a baseline normal. So if something ever shows up, you have something to compare it to. So now I want to talk to you about your skin health. So again, skin cancer in women as well is a very common cancer that shows up in our country. So just keeping an eye on your own skin, and when you do see something new show up or something changing, do not wait. Do not wait. Skin cancer makes up the majority of cancer diagnosis, and this does tend to affect women even more so than men, which is why I'm bringing it to your attention. So make sure you get your skin checked regularly. I'm always checking my own. I'm prone to having moles and new ones show up just because I'm Eastern European and it's part of my nationality, but I go and have a full check every few years with my dermatologist, and I started this when I was actually a teenager. You can keep an eye on it yourself, but it's important that somebody keeps an eye on it as well so that you don't miss something or that you don't have changes in your skin in areas that you can't even see. Do not wait until it's too late. Essentially what I'm saying is early screenings and early detection is really, really important. Let's talk about bone density. True story. When I was in chiropractic school, I was doing an internship in the radiology lab, and I decided to go into the bone density lab to do my internship. When I was little, I hated milk, and I think innately I wouldn't drink milk because it hurt my stomach, and I had a history of digestive issues. So my mom couldn't get me to drink milk. She tried one time, and she knew not to do that again because I actually got sick right on her because she forced me to drink milk. So I wasn't doing milk. I wasn't doing a lot of dairy products. So my mom was worried I wouldn't get enough calcium. So she made me start calcium supplementation at a very young age. So here I am in my early 20s doing my internship in the bone density lab. And I found that I was borderline osteopenia. And I was so upset because I'm thinking to myself, here I am taking calcium most of my life and I have borderline osteopenia. How could this be? Started doing more research on this, and I started talking to some doctors and experts about this. And what they did was they brought to my attention the importance of magnesium to absorb calcium and how magnesium deficient we are and how not calcium deficient we actually are. So I started taking magnesium. I repeated my bone density, and it had improved in only months. So what I'm here to tell you is that bone density screenings are great. The earlier, the better. I was in my early 20s and I had borderline osteopenia. You don't want to start these screenings when you're in your 40s and 50s and 60s. You want to catch these things early so you could do things about it. So you could do things like weight-bearing exercise, keeping your vitamin D levels healthy and optimal, getting the right type of magnesium in, and even checking your hormones properly, because hormones play a part too, especially testosterone. Testosterone is a bone-building hormone, and you want to get this information before you're peri or postmenopausal so you could do something about it, because when you're postmenopausal, those estrogen receptor sites on your bones shut down. So you want to do something preventively, and that's what you'll hear me say over and over again. Prevention is what being healthy is about. The right type of screenings, not just screenings that look to see if you're in the normal range. And this is particularly true when we go to your 5th most important screening as a woman, which is heart screenings. So most of you have what? Blood pressure checks and cholesterol checks. And if you don't go for your well exams, I think that's a huge mistake, because things may be going on underlying for years before you're made aware of it. But you can check your own blood pressure, right? And it's not just blood pressure and cholesterol. We give those things so much attention, but yet half the people who have a heart attack and stroke have normal blood pressure, normal cholesterol. So when you're talking about heart health, take into consideration your family history. And when you're looking at cholesterol, you can find really cool things. Instead of just running lipids, you can see ApoB genotype and things like lipoprotein particle size, which tells you if you have a genetic predisposition to having higher bad cholesterol. You want to look at good cholesterol, and you can bring that up with essential fatty acids, healthy diet, and exercise. You want to check triglycerides, and if they're too high, that means you have too much sugar in your diet. So you want to look at things like insulin and hemoglobin A1C and fasting glucose, because it could actually be a sugar problem causing your triglycerides to go up. And the one thing, the number one predisposing factor for cardiovascular disease or heart disease is diabetes. So you want to make sure you're not just looking at blood pressure and cholesterol. You're breaking down the cholesterol to know what it means. And you're also looking at other things like testing for diabetes through a hemoglobin A1C earlier, sooner rather than later, as well as fasting insulin. That's how you catch these things early. There are some other really, really cool screenings. One is C-reactive protein, and it's a marker of inflammation. And when you have elevated C-reactive protein, you store fat in your belly, and it's actually harder for you to lose weight. And you may have more aches and pains and things of that nature. So the thing with C-reactive protein is it's actually a cardiovascular inflammation marker. So when you have high C-reactive protein, your risk for a heart attack is higher. But yet so few people have this test done. It's very, very important, and I do it as part of my baseline screening. I check vitamin D levels, especially in women, because it affects your bone density. I also check a marker called homocysteine. And when you see high homocysteine, it increases your risk for stroke, blood clot and dementia. And sometimes you'll see homocysteine levels higher in women who have a history of miscarriage or blood clot or a risk factor for stroke in their family. So I look at homocysteine because it's a marker of inflammation in the blood vessel. And if you see it's high, we want to bring it down with important nutrients like methylfolate and methylcobalamin. So these nutrients actually reduce the amount of inflammation in your blood vessels, which can reduce your risk not just for stroke, but blood clot and dementia as well. Another two screenings I'm a huge fan of if you do have higher cardiovascular risk factors is a calcium score. You're checking blood calcium levels because we check cholesterol, but calcium is a bigger issue if you have too much in your bloodstream because it can calcify the arteries and the carotid, which increases your risk for stroke. And those are really, really bad strokes because calcium is way harder than cholesterol is. Cholesterol is a fat, but it's not as hard as calcium. And you can see elevated blood calcium levels in women who have thyroid or parathyroid issues. And women are more likely to have thyroid issues. So in this demographic, it's really important that you get a calcium score to make sure you don't have a high stroke risk. And last but not least, that carotid ultrasound. It's a great screening tool. All of these screenings that I'm talking to you about are not painful and they're non-invasive and they can be done and they should be done, every single one of them, because being healthy doesn't mean being symptom-free. We know sometimes the first symptom of heart disease is a heart attack or stroke. We know that cancer shows up in people that feel perfectly normal and healthy, in people who look perfectly normal and healthy. Everybody knows somebody that looked thin, that looked vibrant, that looked healthy, that worked out, that took supplements and exercised, and still ended up with cancer or heart disease or osteoporosis or gynecological issues. These things can be prevented, but really, prevention is the cure. Prevention is the cure. It's not about diagnosing and treating a disease that has been developing over years and maybe decades. It's about preventing those things. And in order to prevent those things, ladies, we have to stay on our screenings. And we're not just doing the bare bones basic screenings. There are so many amazing tests out there that are good screenings, but you can take it deeper. You can take it down to the next level. So ladies, please share in the comments what you do for prevention, what you do to stay well and healthy, what type of screenings you do. Share that with us because it could save a life. It could educate women and inspire them to get these screenings earlier. I have a friend who just got diagnosed with colon cancer at a very young age, at 40 years old. Most people don't start having colonoscopies until age 50. Well, one thing we know about colon cancer is it's starting to hit a younger and younger demographic. So this is bonus screening, okay? I said I was only going to talk about 5. I'm going to throw a bonus 6th one in there, is a fecal calprotectin. A fecal calprotectin, again, non-invasive. It's done through a stool analysis, and it can be an early detection tool for chronic inflammation, inflammatory bowel disease, and even colon cancer. So if you see somebody's iron and ferritin levels going down, it could be from internal bleeding due to colon cancer. So if you know you've had IBS your whole life, you have a family history of IBD, or you have IBD, Crohn's, colitis, celiac, you can start these screening tools early, and it doesn't have to be something as invasive as a colonoscopy, because to get your insurance to even cover a colonoscopy in somebody who's under 50 years old is challenging. But one thing we know is that the amount of people under the age of 50 getting diagnosed with colon cancer is growing and growing. So I really want you to take your health and these screenings personally. And your family history plays a part. And yes, diet and lifestyle and exercise and supplements, they play a part too. So if you have any questions about this video, any questions about these screenings, please post them in the comments. Myself or somebody on my team will personally reply to connect you to the right information. Share this with your friends and family. Share this with the women that you love, that you know should be taking their health more seriously or should be doing some of these screenings. And maybe you weren't able to talk them into it, but by sharing this video, Maybe that will nudge them to take the first step. Thank you so much for listening, for following, and for allowing me to share my passion for natural health with you. Bye.